Welcome. Have you ever thought about the delicate balance within your eyes, the intricate dance of light and cells that allows you to see the world? Today, we're diving deep into a condition that can disrupt this harmony, a retinal tear. We'll explore what it is, what causes it, how it's treated, and what you can do to protect your vision. So, what causes a retinal tear? The most common culprit is the natural aging process. As we get older, the vitreous humor, that gel-like substance that fills the inside of your eye, starts to shrink and pull away from the retina. This process is called posterior vitreous detachment, or PVD. While PVD is often harmless, sometimes the vitreous tugs too strongly on the retina, causing a tear. Other risk factors included nearsightedness, previous eye surgery, eye injuries, a family history of retinal detachment, and certain systemic diseases like diabetes. To understand a retinal tear, we need to visualize what's happening inside your eye. Imagine the retina as the wallpaper lining the back of a room, responsible for capturing light and sending visual signals to your brain. The vitreous is like a balloon filled with water, pressing against that wallpaper. When the vitreous shrinks and pulls, it can rip a small hole or tear in the retinal wallpaper. This tear allows fluid from the vitreous to seep behind the retina, potentially separating it from the underlying tissue. This separation is known as retinal detachment, a serious condition that can lead to vision loss if left untreated. Retinal tears and subsequent detachments affect people of all ages, but they're more common in older adults, typically over the age of 50, due to the age-related changes in the vitreous. Myopic individuals and those with nearsightedness are also at a higher risk due to the elongated shape of their eyes, which can put additional stress on the retina. Prior eye surgery, especially cataract surgery, can increase the risk, as can trauma to the eye. Specific numbers on incidence rates may vary by region and study, but it's a condition that eye care professionals see regularly. What are the telltale signs of a retinal tear? Often, the symptoms are subtle at first. You might experience a sudden increase in floaters, those tiny specks or strands that drift across your field of vision. You may also see flashes of light, often described as lightning streaks or brief sparkles, particularly in your peripheral vision. A shadow or curtain-like effect obstructing part of your vision can indicate that the retinal tear has progressed to a retinal detachment. It's crucial to remember that these symptoms can also be caused by other, less serious conditions. However, if you experience any of these, especially a sudden onset, seek immediate medical attention from an eye doctor. Diagnosing a retinal tear requires a comprehensive eye exam by an ophthalmologist. The doctor will use eye drops to dilate your pupils, allowing a better view of your retina. Using instruments like an ophthalmoscope and a slit lamp, the doctor can carefully examine the retina for any tears or detachments. In some cases, they may use a special lens to get an even closer look at the peripheral retina. Optical coherence tomography, or OCT, is also used as an adjunct to help confirm diagnosis or monitor the condition. While all retinal tears are essentially breaks in the retina, they can be categorized based on their shape and location. Horseshoe tears are U-shaped and often occur when the vitreous pulls strongly on the retina. Operculated tears are where a small piece of retina is completely torn away, floating freely in the vitreous. Atrophic holes are small, round, and usually occur in areas of retinal thinning. The type of tear can influence the treatment approach. The goal of treatment is to prevent a retinal tear from progressing to a full-blown retinal detachment. Common treatments include laser photocoagulation and cryopexy. Laser photocoagulation uses a laser to create small burns around the tear, essentially welding the retina back to the underlying tissue. Cryopexy, or freezing, uses a probe to freeze the tissue around the tear, creating a similar sealing effect. Both procedures are usually performed in an outpatient setting. If a retinal detachment has already occurred, more extensive surgery such as a vitrectomy or scleral buckle may be necessary to reattach the retina. While we can't entirely eliminate the risk of retinal tears, there are steps we can take to minimize it. Regular eye exams are crucial, especially if you have risk factors like nearsightedness or a family history of retinal detachment. Wear appropriate eye protection when participating in sports or activities that could cause eye injuries. If you experience any sudden changes in your vision, such as new floaters or flashes of light, seek immediate medical attention from an eye care professional. The prognosis for retinal tears is generally good, especially when detected and treated early. With timely intervention, most tears can be successfully sealed, preventing retinal detachment and preserving vision. If a retinal detachment does occur, the prognosis depends on the severity and duration of the detachment. Recent advances in surgical techniques, such as smaller gauge vitrectomy instruments, have improved the success rates of retinal detachment repair. Ongoing research is focused on developing new and less invasive methods for treating retinal tears and detachments, as well as identifying genetic factors that may contribute to their development. Remember, proactive care and early detection are key to protecting your vision.